Ashley Reinke. I'm a lifestyle host and wellness expert, but nutrition is really my forte and what I'm passionate about. And what a lot of people don't know about me is I am actually a patient that underwent IVF not too long ago. And I am currently so grateful that I am 32 weeks along with my first pregnancy. But what's really neat about the guest that we have today is that Dr. A, Guyan, from Reproductive Partners, is actually going to talk to us a little bit about nutrition, IVF, and kind of how that all fits together. So, Dr. A, thank you so much for taking the time to sit down today.
Thank you so much, Ashley, for talking about this topic, and congratulations, by the way. 32 weeks, you're almost there. Hang in there, a few more weeks to go.
I think what's really interesting, actually, what stood out to me about IVF and being, 32 weeks along, is that a lot of women, when they naturally find out they're pregnant, they're already, 4 to 6 to 8 weeks even along. So that kind of whole first trimester, you're not as aware or hypersensitive to what you're eating or your nutrition. But when you're doing IVF, you are so focused from day one, and you know exactly when that transfer is happening, that it's almost like you have this hypersensitive tendency to kind of think twice about everything you do because you've had such a long process. So you have this whole phase that's pre-pregnancy that a lot of women might not experience. So kind of going into that, how would you determine who would be a good candidate for IVF?
So there's obviously a lot of factors that go into the candidacy for IVF, but a lot of it really depends on the couple's or the woman's medical history. Sometimes women come in and they have already tried other treatments. They've obviously tried. A lot of the women who come in already, they're very well aware of some of the other factors, thanks to people like you who constantly educate. So they've already, they already come in saying, I have tried already, changing my diet and exercise and acupuncture and yoga and meditation, all of these things that are also important. But then, they come through, and then we look at the medical aspect, and sometimes they go through other procedures before moving on to IVF. But ultimately, IVF is, women who, the best candidates obviously are women who are younger, where they have better egg quality, and they have a lot of, those factors to work with that are important for success. But of course, a lot of the women who actually need it are women who are a little bit older in their reproductive timeline, and they're the ones where time is truly essential. So there are really many factors that go into the consideration of who's a good candidate. But in a way, I think everyone is a good candidate as long as they're properly informed and properly counseled.
So that's what kind of surprised me was when we went in to meet with our doctor, was I had always been really irregular. And my husband and I knew that we wanted to start a family pretty soon after getting married. So we didn't know that there were kind of all these different treatments. When we went in to meet with our doctor, a lot of women think it's kind of IVF or bust. You just go all the way. Can you tell us about some of the other options? Because IVF might not be the perfect fit for everyone.
Right, absolutely. And a lot of it really depends on the evaluation, on what we know about the couple. So we would usually start with the basics. And if you think about it in the simplest form of life, it's what do we need to get pregnant, right? So we look at sperm, we look at ovulation, like the cycles, and then we look at the uterus, make sure uterus is provides the environment for 9 months for the baby. We look at the fallopian tubes, and last but not least, we look at the egg quality factors, egg reserve factors, and then of course all genetic factors and things like that. So all of these get factored into deciding what the treatment options are. For some women, it's simply just helping them cycle better, meaning ovulate and drop an egg, and they get pregnant. They don't need IVF. But you're absolutely correct. Most of the women, when they walk through the door, they truly think that they're coming in for IVF. And oftentimes I have to step back and say, why do you think you need IVF, or have we already done other treatments? So generally we start with that. If there is a sperm issue, then we start with insemination. Insemination is where we help to push the sperm into the uterus to allow for, more sperm to get to the precious egg. So there are definitely many options before moving on to IVF. However, there are some women who come in and they need to go straight to IVF for various reasons. Sometimes their tubes are not open, so there's no way for egg and sperm to meet, or maybe the sperm numbers are not as high, or sometimes women just get really nervous, especially when we get a little bit older reproductively, where time is of essence. And that's when we oftentimes move on to IVF, mainly to just, get to success the quickest. Because IVF is definitely, if we wanna go get to where we need to get to quicker, that's IVF. But that doesn't mean there aren't any other options available to women to choose from.
Well, and I think you brought up a great point about kind of the various ages of women and how infertility can look so different. I think maybe 15, 20 years ago, you'd hear infertility and you think of this woman that's in her 40s and she's been trying to get pregnant. That's totally changed now. And there are so many different reasons. And that kind of, almost stigma behind infertility that might have once been there has really diminished. And I noticed that at least in certain clinics, women are more open to talking about it. So what kind of determines if somebody is infertile?
So it's the point you brought up is just right on in terms of age and infertility. Even if you read the textbooks and recommendations, the definition of infertility changes based on a woman's age, right? So by definition, the infertility is essentially defined if someone's been trying to get pregnant for a year and has been unsuccessful. But that's for women generally under the age of 37. For someone who's a little bit older than 37, perhaps before the age of 40, we often say 6 months of infertility, 6 months of trying to get pregnant. That's after that they should get evaluation. And the current recommendation is for women in their early 40s is to actually seek at least evaluation right away, because this is the age group where they don't have a year to wait. Okay. But at the same time, education is extremely important in terms of our reproduction in general, because there are some scenarios where when we know there's an obvious problem, couples don't need to wait a year. Oftentimes I see women coming in and saying, I get periods every 6 months, but I was told to wait a year. So those are the scenarios where they need to get help right away, because we know there's clearly something going on as to why they're not able to get pregnant. So what I'm trying to say is that these definitions are important, but no one should really shy away from just getting the information anyways. So we're not, it's better to be more proactive and at least get the evaluation. And if everything is normal, then sometimes we talk to, some lifestyle changes, lifestyle modifications, and then, these patients oftentimes will get pregnant just from the reassurance that everything is okay. So it's always better to get that evaluation. And I don't want people to think that the minute they walk in, the next day we're going to start IVF, because that's usually not the process.
So could you kind of break down a little bit of what that timeline looks like? Because I know that once women kind of decide on something, a lot of women, they might be like me, we're like, okay, all systems go, we're ready, like, let's get pregnant tomorrow. And it doesn't work like that. Patience is a virtue, especially when it comes to this process. So could you maybe kind of break down what the timeline would look like for a woman maybe coming into your office tomorrow for a consultation?
Sure. It actually, amazingly, we can put all this evaluation together and get it done within like a week even, really, if needed, right? Some of it also depends, because for us women, some of our evaluation is actually cycle dependent. So at least I would say that's why at least we need about a month to at least get some information about our cycle, to get the tubal information like the hysterosalpingogram, but the semen analysis and a lot of the blood work and all the rest of the evaluation that we need to look at all these factors can be done fairly quickly. So if someone comes into the office, again, depending on where they are in their cycle, oftentimes we're able to get all this information together in a way where by their next period, they're ready to go into treatments. And like you said, everyone wants to be pregnant yesterday. So when patients come into our office, they have already been trying to get pregnant. So they're really ready to just jump straight into treatments. Sometimes I have to be like, wait, but we don't know what we're treating yet. So we got to obviously know what we're treating before we start the treatments. But you can luckily get most of these testing done fairly quick enough and get answers very quickly and just jump straight into treatments within a month or so.
So if a candidate is deemed as IVF is the best kind of process for them, then you usually have your egg retrieval period, then you'd have your egg testing, and then you would do the transfer. Is that right? Could you kind of explain that little timeline for us?
Yeah, absolutely. We so for IVF, I tell patients, think of it as two phases. Phase one is getting the eggs, preparing for that, creating embryos, and then phase two, once we have the embryos, then preparing for transfer. So big picture wise, I tell patients, think of it in two parts, part one, part two, or two phases. And also really it can be up to about a 3, maybe even a 4-month process. Right? So IVF, so I'll tell patients, if we start today, we're June, you're probably not going to know if it worked or not until about September. So it truly is a 3-month process. But the beauty is that there's a lot of breaks in between. So what 3 months doesn't mean they need to be in the office and injecting themselves with hormones for 3 months straight. Right? So the first phase takes about 6 to 7 weeks, and that's the preparation and going through the egg retrieval. And prior to that, this is where we also start talking about, lifestyle, nutrition, yoga, all of these that are important in success. But that part generally, from preparation to stimulation of the ovaries and then the retrieval of the eggs, can take about again, it all starts with the cycle. So from the beginning of the cycle to egg retrieval could take about 4 to 6 weeks. Okay, and then once the eggs are retrieved, then that's when they're put together with sperm and embryos are created, and then embryos usually spend another 5, 6, 7 days in the lab. And this is when, if we're doing testing on the embryos, we sample the embryos get frozen, the samples get sent out for testing, and then about a week later we get the results, and now phase one is complete and we know exactly what embryos we have to work with. And then second part, then we start kind of preparation for transfer. And again, preparation for transfers again involves preparing physically, making sure the uterus is ready, making sure we got this right timing, and then also making sure emotionally the couple or the woman is also ready to kind of embark on that second part. So.
Well, I love how you break down the two phases, because I think that in both of those phases, nutrition and lifestyle is equally important.
Mm-hmm.
I don't think you can say that it's more important in one phase or the other, because you need both.
Right.
Before I jump ahead to kind of talking about nutrition, how many embryos do you generally kind of say you're able to retrieve? Do you even quote? Because I know that it can be such a variety. I think we had 14 eggs removed. We had 8 embryos tested. We ended up with, I think, 4 or 5 healthy. So, it really does change so much. Do you quote kind of what a woman can expect?
I try to give average numbers for each age group, but what I also tell women is that, look, that's average numbers for each age group, but you're not a number and you're not average, so we're all different. So I can't really tell a woman how many eggs they're going to expect until I've looked at all the factors. And some of the factors for the egg numbers include just the follicle count when we do an ultrasound to count the eggs per month, and then their AMH level, the anti-Mullerian hormone, which gives us a little bit more information about their ovarian reserve. But every woman is different, so it's really hard to quote an actual number, but I'm able at least to set some expectations, right? Because for someone, if I think they can only get 5, 6 eggs, you don't want them to expect 12, because then they're going to be, of course, disappointed. So like I said earlier, it's not about who's a good candidate. It's just about managing expectations and talking about odds and numbers and all of that stuff. And then, of course, as you said, once you go through, then that's another aspect where we just can't predict, right? Some women will go through and get 12 eggs, and out of those 12 eggs, they will have 6 embryos to test, and from those 6 embryos they'll have 3 normal, and that's great. And others will have more than that and have maybe 1 embryo to work with. And sometimes, unfortunately, women in their early 40s, I just had a patient like that where they create a lot of embryos, but sometimes all of the embryos are chromosomally abnormal. So now in that scenario, we have to go through again and create more to hopefully find that one good embryo to get pregnant with. So yeah, you're absolutely right. It's hard to really predict numbers. And that's the hardest part about IVF. When women go into it, it's just, they don't know what to expect. Right? So when you truly talk to women about what scares them the most about IVF, it's that unknown. It's that fear of failure and the fear that they're going to be one of these women where their embryos are just not going to be good quality and they're just not going to have any options for getting pregnant.
Yeah, it's such a good point. And I think that's something that a lot of people don't talk about, is that IVF still isn't a guarantee. You know, at the end of the day, you do everything you can and you kind of hear these miracle stories that it could take 3 or 4 times. It might not. You might have to try different things, to try a surrogate, you know, and there's just still no guarantee. But I actually think that because with IVF, there is so much uncertainty and there's kind of a lot of worry that can go into it. That is where nutrition and lifestyle changes can play such an important role, because that is something that we can do every day that can help build confidence. And I think that when you feel confident on the inside, it does change things around you. And if nothing else, it's going to change your perspective, which, as you pointed out, can be just as important as changing a physical abnormality. By feeling more confident, you're healing that. And that does increase your chance of success.
Absolutely.
So when women come in and talk to you about nutrition, is that something that you're kind of open to talking to them about, or are there, you know, some pieces of advice that you like to give? What's kind of your rule of thumb when it comes to IVF and nutrition?
So I generally just talk about everything in balance and everything in moderation. I'm not the type who's going to say, no, you can't have even like your 1 cup of coffee or half a cup of coffee. Because to me, you know, it's like everything plays a factor, including stress. And we know stress has been like studied and, you know, proven that high cortisol levels can definitely impact outcomes. So I'll tell women, look, if you're stressing out about having a cup of coffee, I'd rather you have that cup of coffee than stress out about it. Okay. But with that said, I just, you know, I usually promote just overall healthy nutrition, right? The question is, what's healthy nutrition, right? So ideally, you want nutrition that's what I tell patients, you want nutrition that's high in antioxidants, right? Protein, but ideally plant-based proteins, as they would, you know, lead to just overall good health. It's common. If you think about it, it's all common sense. Whatever is good for your body overall is also good for your eggs. Okay. Fats are good, but not every fats, right? You want the healthy fats, like the fats coming from nuts and avocados and things like that. DHEA. So like if for protein, ideally you want plant-based and fish-based versus like red meat. So those are generally the basic things that I would talk to women about nutrition, and then, you know, we would just kind of elaborate on that. Oftentimes I get asked, what's one diet that's good for fertility? I don't know if there's one specific diet that's good for fertility, but you may know better. I'm going to ask you. One thing we do recommend, if women are going through stimulation, we actually have them maintain a low carb diet. But that's not necessarily for quality, it's just so that they feel better, they don't get that high insulin spike and they get really bloated throughout the process. So it's also important to differentiate that, because sometimes women think if they had like a piece of dark chocolate, then it's going to affect their IVF cycle. And no, that's not the case. It's just, again, about how they feel. So
right. Our bodies are resilient, and our bodies kind of want to be in balance. They want to be in homeostasis. So your body is going to want to get to that healthy set point. And a lot of the research that I have done while getting my master's in nutrition, it actually lines up kind of healthy body, healthy eggs, healthy baby. And that you can label as a diet. Some people are saying the Mediterranean diet is kind of a great lifestyle to follow. But at the same time, the Mediterranean diet kind of breaks down to what we already know, which is everything in moderation, including moderation. You want to eat a diet that's high in those mono and polyunsaturated fats, high in fruits and vegetables, low in sugar. These are things that we already know, but we just categorize into different types of diets, such as the Mediterranean diet.
Right.
So I've always been a big fan of the Mediterranean diet. I think that it's shown time and time again to help lower the risk of cardiovascular disease, type 2 diabetes, all sorts of kind of health risks. So if it can do that, then imagine all the other benefits that it's going to lead to your body. And again, having a healthy body is going to be what you need to support that pregnancy once the time comes.
Right.
So, but what I also, think, and I'm sure you have an opinion on this too, but there's so many things we can't control. Nutrition is something that you can feel like you're in control of. And I think that's really unique and really neat, because again, when it comes to medical world, we can't control how many eggs we're going to produce.
Right.
We can do our best. We can give ourselves the injections, but we really don't know. But we can plan to eat to feel your best and to incorporate some activity and some exercise. So what is your opinion when it comes to exercise? Because I think that nutrition and exercise really do go hand in hand.
Hand in hand, yeah. Again, in moderation is the key word today, right? It's all about moderation. I also don't want women to exercise like 5 to 7 days a week for 2 hours straight, where they're keeping their heart rate really high. So really all in kind of moderation, but it also depends on each person. So some patients come in and they already exercise a lot, and if it's not interfering with their cycles, then I'm okay with that. But I also tell patients it's great that you want to be more like healthier and start eating better and exercising, but I also don't want them all of a sudden to go from 0 exercise to 100% exercise. It's all kind of like a gradual equilibrium in a way. So I definitely recommend exercise at least about ideally 3 to 5 days a week, at maybe 30 minutes per se. When women are going through the actual stimulation, then I don't want them doing any high impact exercise, because then that could lead to the ovaries twisting and then having a lot of complications after. But definitely kind of going back to one of the points you'd made way before is IVF or fertility in general is definitely a process where you really realize when it all starts, right? Like you said, when women get pregnant naturally, they're not really thinking. I mean, some are, but some aren't really thinking about it. So, and by the time they're pregnant, they know they're pregnant. They're already 4 weeks pregnant, right? But really that 4 weeks, the first 2 of those 4 weeks start with the egg. So when we're in the process of maturing that egg, definitely all of this lifestyle and nutrition, they're extremely important to try to create the healthiest possible egg we can and create the best environment for that egg to become an embryo and then to become a baby.
Exactly. I kind of joked with some of my friends that would, tell me, oh, I didn't even know I was pregnant until I was 2 months in. I'm like, oh, it must be nice. I've been feeling pregnant for 11 months now.
That's right.
But it's one of those things where then in hindsight, it's all worth it. And,
right.
I can absolutely say, people have asked me so many times, and family members, how many injections did you do? Do you remember that? Do you miss that? And it's the kind of thing that when you're going through it, sure, you're aware of what you're doing, but at the end of it, you don't think twice about it. You don't really care. It just kind of, sure, yeah. It was a phase, but I've never had a moment of pausing and being like, oh, that was so terrible, or I wish I didn't have to do that. It was, no, that I'm so glad we did that. It was worth every single step of the way. Because that's just, I think, how these greater things in life work, that you try everything when you know that you want to grow your family. There's really no risk that you're not willing to take, and there's no means that you're not willing to try. So, I think women that go through IVF or go through just infertility treatments in general are some of the bravest women, because
absolutely.
Yeah,
there's definitely that handful that you can think of right away where they've been through so much and they're just so strong. Like they're just sometimes I say, I'm so sorry. And they're like, it's okay. And they try to make me feel better. I'm like, no, it's not about me. This is about you. So, but it's definitely then there are a lot of patients who come in and get pregnant right away without even sometimes needing IVF. And that's great. Sometimes I'll joke and I'll say, they don't know how lucky they are, but that's okay. But every woman has their journey, but like you said, ultimately when it all works out, then it's worth it. So,
well, I have just kind of a feul little rapid fire questions, if you will, kind of a fact versus fiction.
Yeah, because we can talk all day.
Well, these are just kind of things that I found on the internet, and I was like, oh, that is kind of an interesting question. We've touched on them a little bit. But yeah, these are just little fact versus fiction. So I wanted to ask you a couple questions, and you can just give me your honest opinion or what you would recommend to a patient. So topic number one would actually be something you brought up, which is caffeine consumption. How much, at what point do you stop? I remember reading that I was supposed to stop drinking coffee right when I started my IVF treatments. And I was so sad about that idea that I was like, I don't know if I can do this. I need my cup of coffee. So what is your opinion on caffeine?
So, I mean, if you look at the data on caffeine, you have to actually consume a lot of caffeine to have impact, like the risk of like miscarriage primarily or difficulty conceiving. So I tell the patients it's okay to have one, maybe max 2 cups of coffee a day, but that cup of coffee doesn't mean a venti at Starbucks, right? So 8 to 12 ounces ideally. And, women always also ask about decaf, but we also have to remember that even decaf coffee has caffeine in it. So if you're drinking lots of decaf coffee, then you're really probably not doing yourself a favor. But what I do tell them is that I'm okay with 1 to 2 cups. And again, like I stated earlier, I rather have you have that cup than stress out about not having it, because some of it is even psychological. You just have to smell it. Okay. And the same thing once they're pregnant. If they're drinking a cup of coffee a day, then I'm okay if they just continue with that. So
okay. And how about, have you heard of the ketogenic diet?
Yes.
Okay, so there's a lot of information on the internet about the ketogenic diet and IVF. What is your opinion on women who might be on the ketogenic diet and wanting to try IVF? Is it safe? Is it not safe? What would you advise?
I mean, to be honest with you, that's an excellent point. I don't know of any data on what the ketosis from the ketogenic diet will do on the egg quality. So if someone comes to me and says they're on a low carb like ketogenic diet, I would generally advise them to perhaps try not to be in ketosis, at least during that, like I said, phase one of the cycle, mainly because I don't know the true impact of it on the egg quality. And there may be no impact. I don't know. Maybe you can educate me. Maybe you found something on the internet that I don't know, I haven't heard of yet. But because we just don't know, it's that unknown, I rather not have someone go through a cycle in ketosis, basically. There could be some advantages to that, right? That means your insulin levels are really low. So definitely those women are probably not going to have as high of a risk of ovarian hyperstimulation syndrome, or, like some of the symptoms associated with all the hormones. But again, it goes back to the moderation. My thing about when you're going through IVF, and definitely when pregnant, right? You don't want someone on a ketogenic diet when they're pregnant. So really treat IVF as if you were pregnant, right? So I tell sometimes women, if you're truly wanting to lose weight, depending on how much weight you have to lose, either if we have the luxury of time, either try to lose the weight before we start, or if we don't have the luxury of time, then let's create your embryos first, and then you can get to your goal weight and get, as healthy as you want to be. Then we try to get to the second phase, which is trying to get pregnant.
So let's talk about potential side effects for phase 1, which would be collecting the embryos, and then potential side effects for phase 2, which would be more of the embryo transfer.
Yeah. For the collection of the embryos, really truly, it's just as you're taking the injections, the medications, then as the eggs start to grow, because remember, naturally women grow 1 egg a month. Okay. And now you're trying to grow 10, 12, sometimes 20. So we have that many more eggs growing and that much more hormones coming up. So then as women start going through, the key physical side effects that they start feeling is discomfort and bloating. Those are kind of like the main two. And then of course there's all these emotional side effects that come in also. It's interesting that some people will say they feel happier and others are sadder and others are just like crying every day because why do they have to go through this in the first place? So there's so many other factors kind of involved, but those two, like the bloating and the discomfort, are the main ones. And when we do the close monitoring, what we're trying to avoid is this, like the big side effects of IVF, which is ovarian hyperstimulation syndrome. So we're trying to kind of control their hormone levels so that doesn't happen. For the second part, for the preparation, it's actually easier on the body because we're really just trying to mimic our natural cycle by just putting women on estrogen for a couple of weeks. And those can also be transdermal if needed for less side effects. Okay. But the biggest one is the progesterone that we add later for the transfer. And we tend to do injections, and those are the real ouch ones, because they're larger needles. And those are the ones that, everyone looks forward to every day. But
I have to say, I was more nervous about those than they ended up actually being,
Oh, that's good. That's good.
Yeah, I remember thinking like, I'm going to feel this injection all the time. And, you get kind of used to it. And again, I don't know if it's just something where that mama instinct kicks in and it just erases the memory of the pain, but you actually get so used to it that there were times that you kind of feel it, but you wouldn't feel it any more than you would, say, the discomfort of, plucking an eyebrow hair. It's just kind of, okay, something you have to do, but then you move on.
That's great to hear.
Yeah, well, actually, I have to say, like, I don't want to scare anyone out there, because I remember the first time they explained to me, like, oh, this is what's going to happen. I was like, wait, we're going to do this for how long?
Yeah.
And it really wasn't that bad. I was honestly very pleasantly surprised of, okay, we can totally get through this.
That's good.
Yeah. So are there any other lifestyle changes? We talked about exercise, we talked about diet, but any other lifestyle changes that you would really recommend for women and men, actually?
So, well, for men too, I mean, I definitely also talk about vitamins and antioxidants and, kind of like go down the list of what things have been shown to perhaps improve both sperm quality and egg quality. So I go through that with them. I have actually a list that everyone gets, so they can kind of go through it. And then other lifestyle changes, again, it all to me revolves around stress reduction. So I'll tell oftentimes I'll tell them, do what's going to help you reduce your stress. So then they'll say, should I quit my job? I don't know if that's going to be that helpful, because then you're probably going to think about this more and get more stress. Unless you have a really, really high stress level job, then maybe cutting back a little bit during that stimulation phase can help, definitely. I'm really into yoga and meditation, kind of like mind over body type, lifestyle changes. So, and I kind of like sometimes will guide patients in that direction. And then other things we talk about is acupuncture, Eastern medicine, some of those, that help. Again, it's like a whole team of things that you want to bring into the picture to hopefully help in the success. And sometimes therapy. Some women are going to need that fertility coach, the fertility therapist to just talk to and kind of like help them through the process. There's also support groups. I know a lot of women have like Facebook support groups and all of these things, but support groups like Facebook groups are great. But what we always have to keep in mind is that these women have very different stories, and it's great, but it's hard to compare. We can't compare ourselves, because I get that a lot. My friend said this was an issue, or my group person said this was an issue, and that's great. I'm glad they're bringing it up, but we always have to keep in mind that we're all different. Everyone's journey is different.
Absolutely. No, it's a great point. And everyone is different. Every patient is going to be, every woman's different. Every body's different. Would you say that there's actually, an age limit for IVF? kind of an interesting question, you know?
Yeah. It is, it's a great question. I mean, we do know that as we get into our 40s, then it gets more and more difficult to find that good egg to get pregnant with. So ideally, so I don't have an age limit, but I'm very open in terms of what the odds are for women going through. If you're 44, then your chance of success is going to be very, very low, less than 5%. Again, there's a difference between the 44-year-olds, okay? But that same 44-year-old, if they have 34-year-old eggs frozen, then they have their success rates are the same as what it was at 34. So really it depends on at which phase. If we're going through the phases, if it's phase 2, then the success rates don't change much up to age 50. If someone is over 45, then we do, of course, stricter evaluation to make sure they're ready for pregnancy, to make sure their body is ready, their heart's ready, so they're able to have hopefully a healthy pregnancy. But in terms of actually going through an egg retrieval, it's really, really hard we don't see much success, unfortunately, after the age of 45. And that's kind of like the higher end of that age limit.
What would you say is kind of the ideal age if a young woman is interested in freezing her eggs or doing an egg retrieval and then freezing them for later? Because it does sound like it's better to do that sooner than later if that's something you're interested in.
Right. The ideal age to me is definitely under the age of 35, okay? Because that's when we have our better quality eggs, okay? But of course, sooner is better, but it's a fine line. I always tell women, I don't know if I'm a big proponent of freezing eggs at age 25 either, right? Because at that age, we still have a lot of years ahead of us. So of course, at that age, we're going to have great eggs, okay? But that doesn't mean at 28, we're going to have lesser quality eggs. But there are some women where even in that age group, there could be a difference. So if someone is thinking about fertility and thinking about egg freezing, I don't think it's ever too early to ask and to get at least that evaluation done, because someone may be 25, but their egg numbers may be that of a 35 or 38, sometimes even unfortunately a 40-year-old, then those would be, of course, the women that you would definitely encourage them to freeze their eggs right then and there. Versus if someone comes in at 25 and has, the egg count of that of a 25-year-old, then they're okay to wait a few years if needed. So it's really about, age groups are age groups, but each individual is very different. But the ideal age, in my ideal world, everybody would freeze eggs before the age of 35.
Is that something that, if a young woman was kind of interested in the back of her mind, she's thinking, I want to have a family, but probably not ready to do it for the next 5 to 10 years. She's 31, 32. Is that something worth coming in and talking to you about?
Absolutely, because it's all about education. A lot of times these women are on birth control pills, so that even if there were going to be some subtle changes in their cycles, they're not going to catch it because they're on birth control pills. And we unfortunately see some women who come in to talk about freezing eggs, and then when we start testing and we look at their ovarian reserve, it turns out that their egg counts are a lot lower than what we would expect. So definitely, it's always good to talk and get the information. Like I said before, if you walk through an office of a reproductive endocrinologist, doesn't mean you have to do a cycle, you have to freeze your eggs, or you have to do IVF. But information is power, and I think it's great that the word is out and the more women know about, egg freezing and their fertility options. It's all about choice, right? So if they have the information and they've been provided with the choice, then it's their choice. And if they choose not to do anything, that's great. But at least they've had that opportunity to choose for themselves versus our biology just basically choosing for us. So.
Absolutely. And I think being empowered with the option of when do you want to start a family? It doesn't have to be the kind of where you rush into a relationship or a marriage because you want to start a family. It's amazing that it's taken this long, but it's 2020 and it's so amazing that women can have careers and really kind of live that best life and then decide if they want to start a family and do it when the time is right. Yeah. So I think, all these fertility treatments are so empowering in that sense. My last question is actually about conception after IVF. Mm-hmm. just, from people that I've talked to, have you noticed if women that tend to go through IVF for their first child have a higher chance of naturally conceiving for their second?
Yes, absolutely. I mean, it's all anecdotal, but I mean, I see a lot of patients. I've had patients where we've even joked about it, right? They've come in and we've started the discussion about baby number two, and I sometimes I'll be like, well, if you don't get pregnant, I remember one patient specifically said, you realize I was trying for 7 years before we got pregnant with IVF, right? I was like, yes, but remember, there was not a specific reason as to why you couldn't get pregnant. It was unexplained, right? And this woman literally got pregnant like the next cycle on her own. And this is just one example. So definitely, there is definitely something to it, okay? And to personally, I think the biggest factor in that is stress, right? Because a lot of these women who come through, and we talked about this earlier, it's that unknown, right? If you told women, this is going to work for you for sure, they will do anything, right? But it's the unknown when they're going through each cycle, not knowing what's going to happen. That's what creates the most stress, right? And a lot of times they wonder, they tell me, Dr. A, how do I know if I can even get pregnant? Right? Because I've never been pregnant in my life. How do I even know if I can even get pregnant? And that's a hard question to answer because we just don't, right? Until we kind of go through it. But once they have that one baby, then they think, all right, I can get pregnant. I can have a baby. And they're not even really thinking about it because they're too stressed about, like waking up at night or whatever. So, it definitely happens a lot often than we think it does. So.
Yeah. Oh, that's great.
Right.
So
great.
Even though that's just kind of a common thing that I've heard where women would say, well, I went through the treatment. We have, 2 or 3 still frozen embryos, but didn't need them. They kind of ended up being able to then conceive on their own. So,
and I've also seen cases that were like, we've tried like treatments, even IVF, and none had worked, right? So then couples are either taking a break, or sometimes they haven't done IVF yet, so they're taking a few months break between IUI and IVF and they get pregnant. I've had patients who've had multiple failed cycles. We've talked about egg donation and they said, all right, we'll think about it. One thing I always tell patients is please never stop trying, okay? Because you just never know when that one good egg is gonna come through. And so so if there's any message we can get out there is, sure, make your lifestyle changes and nutritional changes and all of these things, but at the same time, even if you fail treatments, don't stop trying because you just never know. Just never know what's going to happen.